Welcome to Radiology Academy. Today we discuss about preparation of brain planning. If you have any type of query, just comment below. I don't receive any comment since I started the stream. Have 2 weeks since. So if you have any type of query, just comment below. It's appreciate me. Today about the MRI brain planning, basics of planning. Generally patient MRI करने के लिए you have to prepare some type of safety screening, and some patients have metallic implant history like pacemaker, bony implant, metallic implant, bony injury. After they have implanted metal in bones, clips, pacemaker aneurysm clips, insulin pump, and some type of hearing machine also. So during the MRI scan you don't have any electrical equipment in this room, so that it's clearly remove any type of metallic element in your body or pocket or wherever it is. So after that you have to remove your jewelry for safety, just because in any type of ionic metal goes to the MRI machine, it's create artifact. It's most important thing, jewelry, earrings, everything. And since the ground it's necessary, just because the synthetic kapur was some type little bit of warm, or it's maybe causes burn, so it's more important to wear hospital gown. It's more safe for you, and don't let enter with watch, scissor, pacemaker, ATM card, and any type of metallic implant in your body. Also phone not allowed in MRI room, just because in MRI there was the magnetic strand is so much high, the 1.5 Tesla, 3 Tesla, nowadays 7 Tesla also in MRI. So it's more important to not wear any type of metallic implant during the scan. Or some patients have claustrophobia. If you see this image in MRI, you will enter that type of area. It's totally closed look like, but both sides are open, so it feels more scary, just because it's more tunnel like area. When MRI scan is running, you don't have to move, so it's more scary, and the sound is so loud. Some patients have claustrophobic, so if you plan for MRI, you just ask whether you have any type of problem with claustrophobia, like previous history of claustrophobia. Claustrophobia means ये ऐसा होता है कि जो स्मॉल एरिया में रहने के लिए डर जाता है, उसको क्लोस्ट्रोफोबिया बोलता है. जो कोई पेशेंट मतलब पेशेंट या नॉर्मल लाइफ में भी जहाँ में लिफ्ट में किसी को डर लगता है, सो ऐसा पेशेंट को MRI में भी डर लग सकता है. इसलिए ये पूछना बहुत ही इम्पोर्टेंट है. क्लोस्ट्रोफोबिया इज़ मोर इम्पोर्टेंट. आस्क टू पेशेंट if any type of problem you have. So some patient needed sedation, like in MRI it's more scary, like lots of patient unable to do MRI normally, so they need to sedation for the scan. So the question is asked must be, some patients have unable to do MRI for that. Stomach patient also have need to ask about there was a breathing difficulty, so that it's more important. Some patients need a monitor control just because they have unable to conversation during the scan. Also critical illness patient also need a monitor. We monitor the SPO level, they are properly breathing or not. Here is the planning, anatomical planning of brain. You will firstly try to plan axial image, so that we need the sagittal localizer. This is not a localizer, this is a actual sagittal T2 image. So I don't have a localizer image, so I use the image. If you see in axial image, we perpendicular the corpus callosum. You imagine a point in this area, and after that you will imagine a 2 point in this area, and you perpendicular with these 2 point and plan whole axial sequence. The axial sequence was started from the foramen magnum in the level of the C1 vertebra and up to cortex. It was the basic planning of MRI brain. You have add whatever you want the slices. It's minimum 20 and normally 25 is acceptable for everywhere. Minimum 20 slices needed for brain MRI. Here you can see the axial planning of this image. You will see the first slice started from this point of foramen magnum. After that you will last slice until then. The cerebrum is ended in that area. So it's the normal axial planning of MRI brain. After that you will next planning will be sagittal planning. In sagittal you have plan axial localizer. In sagittal you have planning in axial localizer. The sagittal image will be planning in the perpendicular to the midline and to the temporal lobe, both sided. It's just easy for planning, but you also see in the sagittal image its midline is properly parallel to the midline. The slice is properly parallel to the midline, so that if there is any type of midline shift, it's properly visible. Or there is any type of area, it's properly visible in anatomically position, so it's help to view the image. The coronal plane also most important. Coronal plane will be planned in sagittal and axial localizer. If you see the axial planning, it's like this corpus callosum, first point to the second point. After that you will imagine a 90-degree angle of this line, and you can plan according to the parallel of this line. So it's little bit easy. If you find the corpusculum start to end point, and you can imagine a axial plane in this line. After that you will imagine a 90-degree angle of the line, and you can plan the corneal image according to that area, frontal lobe to occipital lobe you can plan. And you add 25 to 20 images according to needful area. It's not mandatory how much slice was needed for any type of sequence. It not increase the slice thickness 5 mm to more. It's more important. And also see the axial image for axial localizer for corneal planning. Here you can see this is the frontal lobe and this is the occipital lobe of this planning. Is properly include everything in corneal image. Specialized protocol. Lots of patients have history of epilepsy. In epilepsy we see you can see in this image. Here you can see the edema of this hippocampus area. If that type of problem in brain, we don't identify the normal corneal sagittal image, so we plan a oblique image of the brain perpendicular to the hippocampus. High resolution 3 mm, minimum 3 mm sequence needed for seizure protocol. It's in seizure protocol we need T1 sequence. It's T1. This one is T1. This one is flare. This one is T2. We need 3 sequence for seizure protocol. It's 3 mm needed to view the problem of this area. So sometimes the patient have multiple seizure. After that the doctor advise seizure protocol. So it's mandate to add 3 sequence additional with the brain sequence. Here you can see the problem look like this. In T2 the edema look like little bit of bright, and T1 it's also bright. It's T2 is also bright. This is the flare sequence. Hippocampus stenosis look like this. So I saw the axial planning of seizure sequence. It's needed thin slices because this area is so much small, so that if you added 5 mm, if you plan in 5 mm, it's cut the information. So it needed thin sequence for this scan. This area is called hippocampus. In this epilepsy protocol you have to plan according to the hippocampus. You have imagine a line in between the hippocampus, and you can plan in 90 degree of this line, and you can add hippocampus properly in this slice. Here you can see the axial planning. You will you will find a hippocampus in left or right, both sided. You will find in scrolling T2 image. I will show you the actual image of hippocampus. Here you can see it's a normal brain. It's a right sided hippocampus. This area is called hippocampus. For seizure protocol, you will plan a for seizure protocol, you will plan a line. Imagine a line in this hippocampus and plan according to the 90 degree of this area. So is the right side of the hippocampus. You will scroll to the left side, you will see the left side of hippocampus. This was the left sided hippocampus. So it's properly visible in normal scan. So we need to T2 axial for seizure planning, and after that we'll apply the sequence. For magnetic resonance angiography, we need to, if a patient have some type of tumor or some type of tumor or severe history, stroke history, we need to add angio sequence. So in angio we have skull base 2, we add skull base 2. Here you can see in this bottom of the screen. In angio sequence we plan the angio sequence skull base to the vertex, but we need the circle of Willis. Here you can see it's called circle of Willis. It's so the every artery go in every direction. If there is any type of less blood flow, we find out in this angio sequence. So we need this circle of Willis for angio. Here you can see the circle of Willis ended here. So we plan in this area normally. If there is a lesion behind this area, above of this area, we can add the slice and can increase the slice for that patient. It's needed for if there was a problem beyond this area. So the angio sequence is called top time of flight sequence in MRI. It's specifically so the blood flow appear in bright. After that, venogram. In venogram we include jugular vein to superior sinus. So we plan like if you see this sagittal image, we plan from this area C2 level to the end of the skull. So it's needed to include full area of brain, just because the sagittal sinus will goes in this area above under the skull bone, so it's needed to include whole brain in venogram. So that's all for today. If you have any questions, just comment me in this comment box, and we will figure out how can I help you. Thanks for the watching. Today stream is end right here. If you have any type of query, just comment me and join our WhatsApp group in my channel page to help any type of problem you face during the scan planning or during in any type of radiological imaging, facing any problem. Here you can see the angio of brain. It's look like this. In brain angio, you will see the arteries only bright, and other than everything was showing hypo. The stream ends here for today. Thank you. See you next stream.